Hi, my name is Angela Tercero. I have been a nurse for 13 years. 12 of those have been in wound care. Um, I love it. It's my passion. I wish to further pursue it. I've thought of changing to something else, but every time I always go back to it. With my BSN, I could get a certification. It's the WOCN, which is a really good certification to have. It's a lot of education. Um, Experience with community health has been working in a wound care clinic off of Del Sol. They had an outpatient clinic, so the patients would follow the doctors there after they were discharged from the hospital. And most of them are from the community, from that neighborhood. So you get to see what types of problems everybody has. Usually it's diabetes, um, circulatory problems with their legs. You get to see everything that's going on and a lot of education, but I think that we need to provide more education or some sort of follow-up because a lot of them are non-compliant. I don't think they understand that it just gets worse and worse, or sometimes they don't really care, but I think we need to continue, educating as much as problem, like I said before, in this community is diabetes and all the complications that come with it. People continue to eat and not exercise. On the discussion board, I did talk about parks, where I think that it's very essential to have a nice park where people can meet and run and walk and take their kids out. The elderly can walk around and stuff like that. And the parks that we have in this area are not, friendly. They're not really nice. They don't have nice walking areas where the elderly can go with their walkers or canes, wheelchairs, things like that. There is some, but you got to drive, a couple of miles to get to them. And I think that that's something that we need in this area. Of course, I hope to learn how to approach patients in the community, to see how they need to figure out how they need more help. What can we further educate them with? How would it be possible to help them continue this, or how can us as nurses, especially if you work in the community, keep following up? How can you meet with them? I mean, there has to be some sort of program that we could develop to get to follow up with them, because like everybody else, I mean, we like to be reminded of, you need to do this or don't drink that, or maybe they forget when to take their medications, or they don't have enough money. I mean, there's just so many things that could go wrong in their care. Things I hope to get from this program also is I would like to someday work for the Mayo Clinic. I had applied, but I was lacking the bachelor. They have an amazing culture. I mean, everything's about the patient. From what I know, all the doctors, they get paid a salary, so it's not like, oh, this doctor's better than that one. They work together to try to get that patient, in the best of health they can. They have a lot of research. It's just looks like a really nice place to work. Oh, that's my dogs. See you guys. Bye.